addiction, or all addictive disorders or use disorders, they all have some medical component to why they are there. Opiate addiction is a whole different category in terms of how both physiologically your body gets tolerance, dependence, withdrawal, as well as psychologically it's extremely addictive. Now there's chemicals in your brain that we call neurotransmitters. They regulate various functions, and a couple of these neurotransmitters are very involved in the feeling of reward and gratification, pleasure from different behaviors, from different actions. The main one is dopamine. So there's a pathway in your brain called the reward pathway. Dopamine is that messenger, that signaling transmitter in your brain that runs through that pathway. So if you have an extreme spike in dopamine, your feeling of gratification and reward is extremely strong. So if somebody uses an opiate, you get a surge in the dopamine neurotransmitter in that reward pathway of your brain. Now normally you have some checks and balances, you have inhibitory neurons, basically things that filter and slow down that dopamine. If you have too much reward and gratification, that's when you start showing signs of an addiction. And it's been shown medically and through various studies, imaging and functional MRIs, as well as various other types of studies, that patients that are suffering from an opiate use disorder, an opiate addiction, actually have less blockage of their dopamine in that reward pathway. So when their mind might be saying, I know I shouldn't use this again, I know this caused a problem for me, but they can't really stop, they go right back to it. So they relapse and they continue to use and continue to escalate. That actually comes from that biological basis, is that over production of dopamine and over transmission of dopamine in that reward pathway. Your body physically then starts becoming tolerant to the medication. Your body needs more and more of activation of the opiate receptors. There's different receptors in the brain that things like heroin or let's say OxyContin or hydrocodone, they act on the opiate receptor. Now, opiate receptor makes you feel pleasure and reward, and you feel that's why people continue to self-medicate with it and they use it more and more. However, if you continue to use it, then what happens is when you don't have it and your body goes into withdrawal, it's basically like a rebound. It's like pulling a rubber band really tight and then letting it go. And what lets it go is when you don't have that opiate to hold that rubber band tight. Then your body goes into overdrive and you start developing all sorts of physically really difficult effects to tolerate, diarrhea, cramping, and you feel like your body has bugs on it. You start vomiting, you can't sleep. And that's just part of it. That's only some of what you can experience. So the withdrawal syndrome is very, very difficult to deal with. So the best, most effective way somebody can get rid of those symptoms, and the only way they know how in that situation, is to go get another opiate, to go use again. That's what just keeps perpetuating that cycle on and on, where you're trying to prevent your body from going into withdrawal. You no longer are getting all that euphoria and pleasure sensation. Now it's turned from something magical to just something like a medicine that you're trying to take to prevent some physical illness. And that's because so there is a lot of biology that is the biological changes that are happening in your body when you're addicted to opiates.